What is measles? Measles is an infection you get from a virus. The measles virus lives in the mucus of the nose and throat. It's spread through the air and by coming into direct contact with someone who has it. The virus can stay active on surfaces and in the air for up to 2 hours. It's very contagious. If you haven't been vaccinated and are in a room with someone who has measles, you have a 90% chance of getting it. Part of what makes measles so dangerous is that you can be contagious 4 days before you get the telltale rash. So you could easily spread the virus without knowing you have it. You'll continue to be contagious 4 days after the rash goes away. It is characterized by a prodrome of fever, as high as 105 degrees Fahrenheit, and malaise, cough, coryza, and conjunctivitis, the 3 Cs. A pathognomonic enanthema, Koplik spots, followed by a maculopapular rash. The rash usually appears about 14 days after a person is exposed. The rash spreads from the head to the trunk to the lower extremities. Measles is a childhood infection caused by a virus. Also called rubeola, measles spreads easily and can be serious and even fatal for small children. Where did measles come from? It's believed that the rinderpest virus in cattle jumped to humans in the time around 600 BC. This virus became the measles virus. What does the measles rash look like? The rash starts out as flat red spots on the face and then moves downward over the body. Then smaller raised white spots may appear on top of the red rash. The spots might join together as the rash goes down the body. While death rates have been falling worldwide as more children receive the measles vaccine, the disease still kills more than 200,000 people a year, mostly children. Background of the disease: in the decade before the live measles vaccine was licensed in 1963, an average of 549,000 measles cases and 495 measles deaths were reported annually in the United States. However, it is likely that, on average, 3 to 4 million people were infected with measles annually. Most cases were not reported. Of the reported cases, approximately 48,000 people were hospitalized from measles and 1,000 people developed chronic disability from acute encephalitis caused by measles annually. In 2000, measles was declared eliminated from the United States. Elimination is defined as the absence of endemic measles virus transmission. Endemic endgame. It applies to a defined geographic area, such as a region or country, for 12 months or longer in the presence of a well-performing surveillance system. However, measles cases and outbreaks still occur every year in the United States. It is because measles is still commonly transmitted in many parts of the world, including countries in Europe, the Middle East, Asia, the Americas, and Africa. Since 2000, when measles was declared eliminated from the U.S., the annual number of cases has ranged from a low of 37 in 2004 to a high of 1,282 in 2019. The majority of cases in the United States have been among people who are not vaccinated against measles. Measles cases occur as a result of importations by people who were infected while in other countries and from subsequent transmission that may occur from those importations. Measles is more likely to spread and cause outbreaks in communities where groups of people are unvaccinated. Outbreaks in countries to which Americans often travel can directly contribute to an increase in measles cases in the United States. In recent years, measles importations have come from frequently visited countries. They include, but not limited to, the Philippines, Ukraine, Israel, Thailand, Vietnam, England, France, Germany, and India, where large outbreaks were reported. What is the difference between measles and German measles? Measles, rubeola, and German measles, rubella, are similar in some ways. They have some symptoms in common, such as fever, sore throat and rash. However, the virus that causes measles is different than the virus that causes German measles. German measles is very serious for those who are pregnant. This condition can cause the person to miscarry or can cause birth defects in the baby. Both viral diseases can be prevented by getting one vaccine. Who does measles affect? Anyone who isn't vaccinated can get measles. Before the measles vaccine was available, almost everyone got measles. If you have had measles or were vaccinated against measles, you're more likely to be immune to the measles virus. you can still get atypical or modified measles after the vaccine. Symptoms of measles. Measles signs and symptoms appear around 10 to 14 days after exposure to the virus. Signs and symptoms of measles typically include fever, dry cough, runny nose, sore throat, inflamed eyes, conjunctivitis. Tiny white spots with bluish-white centers on a red background found inside the mouth on the inner lining of the cheek, also called Koplik spots. A skin rash made up of large, flat blotches that often flow into one another. The infection occurs in stages over 2 to 3 weeks. Infection and incubation. For the first 10 to 14 days after infection, the measles virus spreads in the body. There are no signs or symptoms of measles during this time. Nonspecific signs and symptoms. Measles typically begins with a mild to moderate fever, often with a persistent cough, a runny nose, inflamed eyes, conjunctivitis, and a sore throat. This relatively mild illness may last 2 to 3 days. Acute illness and rash. The rash is made up of small red spots, some of which are slightly raised. Spots and bumps in tight clusters give the skin a splotchy red appearance. The face breaks out first. Over the next few days, the rash spreads down the arms, chest and back, then over the thighs, lower legs and feet. At the same time, the fever rises sharply, often as high as 104 to 105.8 Fahrenheit, 40 to 41 Celsius. Recovery. The measles rash may last about 7 days. The rash gradually fades first from the face and last from the thighs and feet. As other symptoms of the illness go away, the cough and darkening or peeling of the skin where the rash was may stay for about 10 days. What causes measles? Measles is caused by an extremely contagious virus called morbillivirus. In fact, if 10 people who weren't vaccinated were in a room with someone with measles, 9 of those people would get measles. Measles is spread by 1. Contaminated droplets that are spread through the air when you cough, sneeze or talk. 2. Kissing someone who has measles. 3. Sharing drinks or food with someone with measles. Shaking hands or holding hands or hugging someone with measles. 4. From pregnant people to their babies, either during the pregnancy, delivery or while nursing. The airborne respiratory droplets can remain in the room even after the person with measles is gone. It can take 6 to 21 days to develop symptoms of measles after you've been infected. This is the incubation period. You're contagious about 4 days before you develop a rash to about 4 days after the rash starts. Risk factors for measles include being unvaccinated. If you haven't had the measles vaccine, you're much more likely to get measles. Traveling internationally. If you travel to countries where measles is more common, you're at higher risk of catching measles. Having a vitamin A deficiency. If you don't have enough vitamin A in your diet, you're more likely to have more severe symptoms and complications of measles. Complications of measles may include diarrhea and vomiting. Diarrhea and vomiting can result in losing too much water from the body, dehydration. Ear infection. One of the most common complications of measles is a bacterial ear infection. Bronchitis, laryngitis or croup. Measles may lead to irritation and swelling, inflammation, of the airways, croup. It can also lead to inflammation of the inner walls that line the main air passageways of the lungs, bronchitis. Measles can also cause inflammation of the voice box, laryngitis. Pneumonia. Measles can commonly cause an infection in the lungs, pneumonia. People with weakened immune systems can develop an especially dangerous type of pneumonia that sometimes can lead to death. Encephalitis. About 1 in 1,000 people with measles can develop a complication called encephalitis. Encephalitis is irritation and swelling, inflammation, of the brain. The condition can be especially dangerous for people with weakened immune systems. Encephalitis may occur right after measles, or it might not occur until months later. Encephalitis can cause permanent brain damage. Pregnancy problems. If you're pregnant, you need to take special care to avoid measles because the disease can cause premature birth, low birth weight and fetal death. People at high risk for complications. People at high risk for severe illness and complications from measles include 1. Infants and children aged below 5 years. 2. Adults aged above 20 years. 3. Pregnant women. 4. People with compromised immune systems, such as from leukemia and HIV infection. How is measles diagnosed? Your doctor will probably be able to diagnose measles by examining it. However, they may order laboratory tests to find the virus in samples of 1. Blood. 2. Secretions from your nose and throat. 3. Urine, pee. How is measles treated? There's no cure for measles. The virus must run its course, which usually takes about 10 to 14 days. You can do some things that might make you feel better, such as 1. Taking acetaminophen or ibuprofen for aches, pains or fever. 2. Getting plenty of rest. 3. Drinking enough fluids. 4. Gargling with salt water. 5. Avoiding harsh light if your eyes hurt. Note: never give aspirin to children or teenagers unless your healthcare provider specifically tells you to because of the risk of Ray's syndrome. Prevention of measles. The U.S. Centers for Disease Control and Prevention, CDC, recommends that children and adults receive the measles vaccine to prevent measles. Measles vaccine in children. The measles vaccine is usually given as a combined measles mumps rubella (MMR) vaccine. This vaccine may also include the chickenpox, varicella vaccine, MMRV vaccine. Healthcare providers recommend that children receive the MMR vaccine between 12 and 15 months of age, and again between 4 and 6 years of age, before entering school. The MMR vaccine's 2 doses are 97% effective in preventing measles and protecting against it for life. In the small number of people who get measles after being vaccinated, the symptoms are generally mild. Keep in mind, if you'll be traveling internationally outside the U.S. when your child is 6 to 11 months old, talk with your child's doctor about getting the measles vaccine earlier. If your child or teenager didn't get the 2 doses of the vaccine at the recommended times, your child may need 2 doses of the vaccine 4 weeks apart. Babies born to women who have received the vaccine or who are already immune because they had measles are usually protected from measles for about 6 months after birth. If a child requires protection from measles before 12 months of age, for example, for foreign travel, the vaccine can be given as early as 6 months of age. But children who are vaccinated early still need to be vaccinated at the recommended ages later. Providing a child with the MMR vaccine as a combination of recommended vaccines can prevent a child's delay in protection against infection from measles, mumps and rubella, and with fewer shots. The combination vaccine is as safe and effective as the vaccines given separately. Side effects are generally mild and may include a sore arm where the shot was given and fever. Measles vaccine in adults. You may need the measles vaccine if you're an adult who does not have proof of immunity and has an increased risk of measles, such as attending college, traveling internationally outside the U.S. or working in a hospital environment. Was born in 1957 or later. If you've already had measles, your body has built up its immune system to fight the infection, and you can't get measles again. Most people born or living in the U.S. before 1957 are immune to measles, simply because they've already had it. Proof of immunity, protection from getting measles infection, includes written documentation of appropriate measles vaccinations, lab tests that show evidence of immunity, lab tests that show you've had measles in the past. If you're not sure if you need the measles vaccine, talk to your healthcare provider. Preventing measles during an outbreak or known infection. If someone in your household has measles, take these precautions to protect family and friends without immunity. Isolate. Because measles is highly contagious from about 4 days before to 4 days after the rash appears. People with measles should stay home and not return to activities where they interact with other people during this period. People who aren't vaccinated, siblings, for example, should also stay away from the infected person. Vaccinate. Be sure that anyone who's at risk of getting measles who hasn't been fully vaccinated receives the measles vaccine as soon as possible. This includes infants older than 6 months and anyone born in 1957 or later who doesn't have proof of immunity. Preventing new infections. Getting vaccinated with the measles vaccine is important for promoting and preserving widespread immunity. Since the introduction of the measles vaccine, measles has virtually been eliminated in the US, even though not everyone has been vaccinated. This effect is called herd immunity. But herd immunity may now be weakening a bit, likely due to a drop in vaccination rates. The incidence of measles in the US recently increased significantly. Preventing a resurgence of measles. Steady vaccination rates are important because soon after vaccination rates decline, measles begins to come back. Here's one example. In 1998, a now discredited study was published incorrectly linking autism to the measles mumps rubella (MMR) vaccine. In the United Kingdom, where the study originated, the rate of vaccination dropped to an all-time low of about 80% of all children in 2003 to 2004. In 2008, there were nearly 1,400 lab-confirmed cases of measles in England and Wales. No proven link between the MMR vaccine and autism. After the MMR study in 1998, some drops in vaccine numbers were found in the UK and elsewhere, and some people believed there was a possible link. Since then, widespread concerns have been raised about a possible link between the MMR vaccine and autism. However, extensive reports from the American Academy of Pediatrics, the National Academy of Medicine, and the CDC conclude there is no scientifically proven link between the MMR vaccine and autism. These organizations note that autism is often identified in toddlers between the ages of 18 and 30 months, which is about the time children are given their first MMR vaccine. But this coincidence in timing shouldn't be mistaken for a cause and effect relationship.